Welcome. As a quick introduction, my name is Corey Rood. I am a child abuse pediatrician here at Primary Children's Hospital with the Division of Safe and Healthy Families. I'm also an assistant professor with the University of Utah. And I'm not only a child abuse pediatrician, but an expert in human trafficking, specifically as it pertains to families and children. I spent some recent years on the Ohio Human Trafficking Task Force, and I'm currently a medical representative on the Utah Trafficking in Persons Task Force. So this basic presentation on human trafficking will focus specifically on how it pertains to adolescents. But please understand that human trafficking is a pandemic that's affecting people of all ages across the globe, and not strictly pertaining to U.S. Children only. To begin, I have no financial relationships with anything that I share, and please understand this presentation is a difficult topic for many people, but it does have a call to action. Hopefully you will leave this presentation with an idea of what you can do, both for survivors as well as a community member, to get involved in helping to recognize and prevent trafficking wherever you are located. The basic objectives of this presentation are to understand what human trafficking is, and to do so we need to understand the overriding umbrella of exploitation. Again, I'm specifically going to focus on domestic minor sex trafficking in this presentation, and in doing so, we'll point out the common vulnerabilities of the victims of domestic minor sex trafficking, or DMST, identify ways in which medical providers and mental health providers can recognize and act when they have a suspicion or concern for trafficking, discuss basic identifiable characteristics of victims, and then to review some trauma-based interventions that are not yet evidence-based, but are being currently used for trauma victims of other types of trauma. As we know, human trafficking is a pandemic, and its faces are many. Sex trafficking specifically is one of those many faces of human trafficking, and although less prevalent than labor trafficking, both here in our country as well as internationally, it is one we will focus on today. We do not have time to cover all of these different types of human trafficking, but please understand that there are many forms, and they affect persons both locally as well as in all other countries. So when I give this presentation to an audience, I ask for audience participation. I would ask that as you watch and listen to this, we will go through a few clinical vignettes. Instead of standing or staying seated, what you may think to yourself is, do I think this is trafficking or not? So I will give you some clinical vignettes, and just think to yourself, is this trafficking? So the first one is, and these are, again, real patients who have been seen with the identified information. Young 15-year-old female comes into the emergency room because of an acute sexual assault. She is found to be pregnancy positive as well as HIV positive. She has a forensic interview at a local children's justice center, and in that interview she states that men pay her sister to have sex with her. Her sister is 18 years old. So I give you a moment to reflect. Is this trafficking? Is this not trafficking? So this one's a softball, and should be easily recognizable as trafficking. There's a recognized trafficker who is the sister And this victim, come to find out, had many victimizations at the cost of this trafficking that was perpetrated by her sister and by the buyers. The next clinical vignette is a 17-year-old male labeled a runaway from his foster home. He's on the street. He's homeless. He occasionally will trade sex to stay on a couch or for a bite to eat when he doesn't have the cash. And he states that this is usually with friends or with other people he's met. So think to yourself, is this trafficking or not trafficking? So according to federal statutes, this is considered trafficking. This is survival sex. So he is trading a sexual service for things that he needs to survive, such as food, a place to stay. And unfortunately, he's not only a victim, but this often is under-recognized as a form of trafficking in our country, especially with homeless and runaway youth. The next vignette is a 16-year-old female. She lives at home with her family. She will post online personal ads, personal classifieds for sexual favors. She provides those sexual favors or sexual pictures or videos for money. She collects that money for herself. She's otherwise an honor roll at school. She's on the honor roll at school and has a stable family home. She does this in her spare time, evenings and weekends. So think to yourself, is this trafficking or not trafficking? So in the United States, because she's a minor, the exchange of commercial sexual services is its form of commercial sexual exploitation of a child. So you have exploitation. It can be argued that her buyers are potentially her traffickers. There is not specifically a form of. This is not specifically a form of prostitution, as the terms child prostitute and adolescent prostitute should not exist, as these are victims, and although they are often referred to, unfortunately, as prostitutes, hopefully that term is on its way out, and we are recognizing these persons, especially the youth, as victims. And in this case, she is a victim of exploitation and potentially trafficking. The final scenario is a 16-year-old male. He uses marijuana and occasionally methamphetamine. He usually pays cash for these drugs, but every now and then he doesn't have the cash. He wants the drugs, so he'll exchange a sexual service for usually the meth because he can't afford it. He considers these consensual, and he also says he's consensually sexually active with peers. At other times, he does live at home. So think to yourself, is this trafficking or not trafficking? So again, he's not doing these sexual services to survive, but he is exchanging sex for a commercial product. He is purchasing that, and that is trafficking. It's sexual exploitation of a child, and so his traffickers could be portrayed or potentially the sellers of the drug because of that addiction and that commercial exchange for sex. So hopefully these vignettes have helped debunk a few of the myths that pertain to human trafficking. One, that you need force, fraud, or coercion to prove that trafficking has occurred to a minor. And according to the federal statute, which we will review here in the next few slides, we will hopefully recognize that force, fraud, and coercion are not necessary to prove that a child has been trafficked. Also, it is our own children here in our own country, and not necessarily children from other countries or undocumented immigrants only The other thing to recognize is that these vignettes show that you don't have to have transportation, travel, or movement across states or national borders. It's not only women and girls who are affected, and many of these victims consider their commercial exchange to be consensual. So when it comes to Utah, unfortunately, it's a common misconception that trafficking doesn't occur in Utah. And so I've pulled a few news articles from the past 3 years that show that human trafficking definitely occurs in Utah. Unfortunately, these are only the tip of the iceberg, because those are what hit the news the most. Preposterous or the most inflammatory are those that the news are going to portray. So being that this is the tip of the iceberg, there are hundreds of other cases that go unseen. But as you can see from these news articles, they contain labor trafficking victims, sex trafficking victims, adults and minors. And they're all across our state, often concentrated in the major cities, but again, they can be in the rural towns as well. So now that we understand what basically the umbrella concept of human trafficking and the faces of human trafficking, and that it's present here in Utah, let's move into the actual definitions of what trafficking is. So Dr. Estes from University of Pennsylvania stated that child sexual exploitation is the most hidden form of child abuse in the United States. And North America today, it is the nation's least recognized epidemic. And he actually began publishing data on human trafficking statistics in the United States as early as 2001. And his research is well known today. So here's a short clip. It's a snippet from an actual interview done by Jada Pinkett Smith on CNN regarding the human trafficking industry with regards to children.
There's no one profile. It's whatever that buyer wants, that pimp, that trafficker will go out and get. Generally, you want to say that it's a young girl or a young woman on the streets in high heels, skimpy clothes. You know, she could be wearing dungarees or blue jeans and a T-shirt with a backpack on her, because that's the fantasy of that man who wants to buy her that day. So she looked like a typical schoolgirl.
Williams says most of the girls in her program come from troubled homes where they felt ignored. A vulnerability traffickers are quick to exploit.
This is their job. They will sit down and let your daughter or son talk to them for 3 to 4 hours straight without interrupting them. I don't know a mother today or a father today or a grandma that has 3 hours just to sit there and not say a word and let their children talk to them just like they want to. That trafficker, that pimp,
all day.
All day. They're going to learn every piece of information about your child, because that's how they keep them.
It was more of a conversation. But I tell him how me and my sister get in an argument, and he'd be like, you can't be getting an argument with your sister like that. He was more like a dad, but then again, we had sex, so it wasn't. So it was just the communication and how he talked to me.
After gaining her trust, the trafficker began asking her for favors.
He slowly put it on me like, I need you to do me a favor. I need you to make this money for me because I really need it. So I did. And then he was like, I love you for that. I love you so much. Da, da, da. And then he would slowly put 2, 3 more guys. And I got upset when I first realized what he was doing. But I kept doing it because he made me feel like I was special.
Night after night, dozens of men, one right after the other.
Mostly on the weekends, we go to hotels and they'll have sex with me, drugged up and slobbing on me. One day, but I was like, I can't do this no more. I was in pain. I felt like my insides hurted. I felt like in this area it hurted really bad because one day I had sex with almost 40 guys in one day, and I was so tired, and I said, I can't do this no more.
But her trafficker made sure she knew leaving was not an option.
He was like, you ain't going nowhere. And I was like, you want to bet? And then he went to the other room, came back with a gun, and he was like, if you go somewhere, we'll see. He said, I bet you'll be back tomorrow. I bet.
Sasha Ray says she found leaving more difficult than she planned. It wasn't just the threats he made. It was the psychological tactics he employed. When he wasn't threatening her, he acted like he loved her.
It was just like that feeling of him like caring about me, but I knew he didn't. But I still went back.
So I want you to take a moment to think about what impressed you most from that short interview. Sasha Ray is sharing what it is that she's experienced. What is it that stood out to you from that? I will tell you, having watched that interview quite a number of times, what stands out to me most are a couple of things. One, Sasha Ray, who is the survivor in that interview, stated at one point that 40 men had sex with her in one day, and you can see the expression, the shock, which Jada Pinkett Smith, the interviewer, keeps under control, but you can still read it on her face, that shock. Unfortunately, it's estimated that victims of sex trafficking can be victimized anywhere between 10 and upwards of 50 times a day. The other thing is that interview goes on to demonstrate that trauma bond, which we will talk about here in this presentation, but that trauma bond of how Sasha Ray was looking for that father figure, that person who loved and cared for her. And this person who she found would traumatize her, threaten her with a gun, but at the same time express how much he loved her. And that goes to show how that trauma bond begins to form day in and day out with these young minds, especially. So in order for us to fully understand trafficking, we need to understand what exploitation is, and that's simply the act of treating someone unfairly so that you can benefit from their work or from their exploitation. In doing so, there are a number of types of work. One of those is a commercial sexual act, and that's when a sexual act is exchanged for something of value. When that commercial sexual act in the form of exploitation is perpetrated on a child, that's considered CSEC, or commercial sexual exploitation of children. The human trafficking aspect specifically comes into play when you have not only the exploitation piece, but it can be perpetrated by any of the persons in the chain of control over that person. So the person who recruits, harbors, transports, provisions, obtains, all of those persons are trafficking in their own right. Now, to understand, so that we're clear, trafficking is different than smuggling. So when we think of international trafficking, labor trafficking, very different than smuggling. So when a person is smuggled, I think of it as a business negotiation. A person is going from their starting point, crossing often international borders, undocumented, into a place where they would prefer to be, and a person who transports or smuggles them does so for a fee. And so when we think of smuggling specifically into the United States, I give the example of I spent some time in Guatemala looking at child abuse and trafficking from that country into the United States. At the time I was there, which was in 2016, the going rate for being smuggled from Guatemala into the United States was $14,000 US. You pay $7,000 US on the front end. Once you were smuggled into the United States, then it was another $7,000 on the back end. Now, if you were able to pay that, the business negotiation was final and you were free to go undocumented on your way. Unfortunately, that population is incredibly vulnerable. And so if that business negotiation does not proceed as agreed upon, and there's a component of exploitation, so that there's a debt at the end, and to work that debt off, you're consigned to a specific work, and there's no liquidation of that debt, or you end up paying more because of interest and so forth than you originally were promised, or there are threats made against you or other persons, whether they are acted upon or not. Those bring into that scenario a component of exploitation, and that is trafficking. Back in 2000, the federal TVPA, or Trafficking Victims Protection Act, was passed. It has had a few amendments since then, but it states that severe forms of trafficking in persons include sex trafficking and labor trafficking, that they are induced by force, fraud, or coercion for a specific act or work, as we discussed. As you can see, under labor trafficking, those are defined as involuntary servitude, peonage, debt bondage, or slavery. We will not go into the definitions during this presentation on labor trafficking, but please keep in mind that force, fraud, and coercion are not required for victims under the age of 18, according to federal law. So when we think of the components for trafficking, according to federal law, there needs to be an act, a means, and a purpose. We'll break it down simply. The act is one of many forms, trying to pertain to all the persons involved in the trafficking of a victim. So everywhere from recruitment to the sale, transportation, harboring, provisioning, all of those persons who are privy to that commercial gain from the exploitation of that person or participate in their exploitation are traffickers. Again, the means are force, fraud, and coercion. These are not pertinent to victims under the age of 18, but knowing that they are required for adults. Coercion specifically is a threat of serious harm against any person, including schemes intended to threaten indirect harm. And the purpose, the work, which we've discussed at length. So, we now understand the basic definitions and the federal law as it pertains to trafficking. We are going to touch a little bit on the epidemiology of human trafficking. So when we look at a world perspective, it's estimated by the International Labor Organization, and these numbers vary because of the difficulty of estimating or even pinning down the exact number of modern-day slaves. This pertains to all forms of trafficking, but it's well estimated with pretty accurate numbers by the ILO back in 2012, and the numbers are consistent today, that around 21 million persons are victims annually of modern-day slavery. You can see the statistics here. That's 3 per 1,000 people in the world, and it's nearly equal between males and females. $150 billion US is the global yearly earning on the backs of slaves. That's $4,750 US per second. And we can see here that the the major forms of trafficking in the world are labor trafficking, followed by sex trafficking, and then there are, organ harvesting, mail order brides, child soldiers, child brides, and the list goes on. With regards to the United States, so we gather data with regards to the United States based on a number of various statistics. One of those is the National Human Trafficking Hotline run by the Polaris Project, a fantastic non-for-profit organization that is combating trafficking on a global scale. They had 7,500 confirmed U.S. trafficking cases in 2016. Each case had at least one victim. Some had more. 73% of those cases or the victims were sex trafficking. You can see the numbers here. 40% were children. 45% were actual U.S. citizens. To help debunk those myths that these victims are all from other countries, that's not true. 10% were male. And again, these numbers are as accurate as we can get as we begin to understand the numbers and begin to screen, identify. Our numbers will become more accurate. It is well known that male victims are underrepresented for multiple reasons, and one pertains to the stigma of them coming forth and reporting their victimization. 14% were labor trafficking, and this is felt to be quite underreported. One, due to under-recognizing the victimization of labor trafficking, the multiple industries in which it occurs. With regards to sex trafficking, since that is the topic we will narrow in on, when it comes to the world data, 4.5 million of that 21 million victims worldwide are sex trafficking victims. Here in the United States, 31,000 confirmed cases of trafficking since the National Human Trafficking Hotline opened in 2007. Now, there was a recent study out of San Diego County looking at the sex trafficking victims in the gang population. So gang-related sex trafficking, they looked at the population and interviewed victims between 2011 and 2013, persons, youth and adults who were affiliated with the gang population, had been arrested, had escaped, and they found that on average in those years between 3,400 and 8,100 victims annually of sex trafficking with regards to gang activity in San Diego County. And that's a staggering number. Again, that's one county in our country. It's a very populated county, but it gives you an idea of the gang's involvement in trafficking of humans. $32,800 is the weekly average revenue estimated by the Urban Institute in 2014 for a pimp or trafficker in a large U.S. city. You can see if that's the weekly average revenue, the annual revenue is staggering in the millions. With regards to the National Human Trafficking Hotline, they put out a heat map each year with regards to all the cases reported. You can see the heat map here with regards to the United States. Each case, again, can have multiple victims, but specifically the heat map, obviously concentrations of trafficking as reported are where there are major cities or large populace. Because I work here in Utah, the specific concentration that I am focused on is here in Utah, in Salt Lake City along the Wasatch Front. We also become quite concerned with our relation to Las Vegas as well as Denver, that there are concentrations of trafficking reported from those neighboring cities as well. With understanding at what age do these victims enter labor trafficking or sex trafficking victimization, there are a number of studies out there. The consensus is that the majority of victims enter somewhere in their teens to youth age range. And you can see here on this this specific study shows that 49% of sex trafficking victims entered in that 12 to 17 years of age range. And with regards to labor trafficking, there was also a peak during the teen years. This speaks to vulnerability of adolescents as well as youth. We look at the 18 to 23-year-old range. These are early adulthood, college age range victims, and so there's a peak there as well. To support that data, there are a number of statistics, and some of them raise an eyebrow. As I mentioned, Dr. Estes from the University of Pennsylvania back in 2001, his publication stated that average age of entrance into domestic minor sex trafficking was between 12 to 14 years of age. You can understand how that raised some eyebrows and some attention. Carpenter and Gates, that's a study out of San Diego County with the gang involvement. Those victims stated that their average age of entrance was 16. And then the Polaris Project, which runs the National Human Trafficking Hotline, their data states, as they've interviewed victims, that it's somewhere around 18 years of it's around 18 years of age, although 44% of their victims were 17 or younger, so were minors. With regards to Utah, the National Human Trafficking Hotline does have data for Utah. Again, these reports to the National Human Trafficking Hotline are those called in by persons. It's not a mandated reporting hotline. It's mostly used by victims or family, friends of victims, or the public. You can see from 2007 to 2016, there were 630 calls based out of Utah, which identified 129 cases and 189 victims. We are currently studying and will be screening eventually the juvenile justice population for trafficking. We've been running a study looking at sexually transmitted infections, and as part of that study in the juvenile justice system with those adolescents, we have been asking about survival sex since about 2015. Not surprisingly, survival sex does occur, and it's somewhere between 3.5% and 5.5% of those responding to the survey are saying yes to survival sex. And again, that's a form of exploitation and trafficking of minors. So specifically domestic minor sex trafficking, which is sex trafficking here domestically in our own country of our own youth, whether those youth are documented or undocumented. It is here domestic, and there is not a crossing of international border. From the Polaris Project Survivor Stories, Brittany met a man at her local mall who offered her a job at his restaurant. Instead of working as a waitress, Brittany was forced to sell sex in a hotel room. So what is domestic minor sex trafficking? It's really a form of one of three major types of trafficking, which I tried to caveat in those vignettes in the beginning. So there's the stereotypical trafficking where you have a trafficker or a pimp who can be a family member or a stranger or a loved one who has control over victims, and they are forced to perform sexual acts, strip, dance, escort services, child pornography. That's your classic type of trafficking and pertains to domestic minor sex trafficking as well. The next subtype is survival sex, which we've discussed. This pertains to minors because of that exchange of a commercial need, such as place to stay, food, clothing, for sexual service. That is a form of trafficking. And then there's a third subtype, which is far less recognized and often labeled as prostitution, which is unfortunate, but it is those adolescents or kids, such as in the vignette, who are posting their own classifieds for sexual services, collecting the money themselves, and are not using it for survival, but simply for financial gain or for drugs or some other product of value to them. And again, this is the most under-recognized form of trafficking in youth in our country. So with regards to human trafficking, there are multiple populations of youth that are recognized as being exceptionally vulnerable to trafficking and exploitation. The data supports multiple reasons for why these youth in these specific populations are at higher risk. And I won't go into great detail, but any youth who are homeless, have run away or been kicked out, thrown away, are out on the street, and they are vulnerable to survival sex needs. They are vulnerable to exploitation if persons come to them offering them jobs, other ways to provide for themselves that end up being exploitation. Again, they are desperate and are vulnerable in that way. Research supports that those youth who have experienced child abuse, neglect, assault, sexual abuse, exposed to domestic violence in their home, or drug abuse in their home, are at an exceptional risk for exploitation and trafficking as they enter their early adolescent years. Those who have been involved in the foster care system, and it's not specifically because of the foster system, but it's because of the reason why they enter the foster system, that trauma that they've experienced prior to entering. And then again, once they're there, then there's often movement from placement to placement. And like was demonstrated in the interview with Sasha Ray, they're looking for that father figure who loves them and supports them, and sometimes, unfortunately, those kids don't find that in their placements during their foster care time. The juvenile justice system, those youth are in the juvenile justice or detention center system because of their acts or because of something they've been a victim of, unfortunately, and they are set up for vulnerability to exploitation. And then we know that those youth who identify as LGBTQ, those youth who have a diagnosis of a mental health disorder, as they are labeled, can be discriminated against, can be pushed aside potentially by their community or their family or their culture or any group of affiliated family, friends, or community that they reasonably felt connected to and now have felt pushed away or disregarded. That puts them at a higher risk for searching for that affection and that recognition from other sources, which unfortunately can be someone who wants to exploit them. And then we know that those persons who are displaced from their homes, so refugees, immigrants, are at incredible risk for being exploited by persons either in their journey or upon their destination who want to take advantage of their state of instability. So to help support some of this risk population information I've shared, there are a few research studies out there that support this. Two of them look specifically at the vulnerabilities that come with a history of sex abuse, physical abuse, and exposure to domestic violence or sexual assault. Because I'm a child abuse pediatrician, this specifically interests me because of the population I see. You can see here the Goldberg study in 2016, 90% had prior exposure to some form of child maltreatment in their childhood prior to being exploited or trafficked. The National Center for Missing and Exploited Children looks at statistics every year, and these statistics are from 2015. They are very similar to those from 2016, but there are just over 1.5 million children who run away each year in our country. And they, again, these are only those that are reported, but it's estimated that between 1 in 5 and 1 in 6 of those children who run away are at incredible risk, if not already being trafficked during their time as a labeled runaway. This is unfortunate, and somewhere between 18 and 20%, which is staggering. 74%, and somewhere between 74 and 85% of those runaways that were sex trafficking victims were found to be have a history or be in the care of social services or foster care when they went missing. So again, it's not specifically the system. There are imperfections in any system, but we need to go back further and realize that these are victims of trauma, often at an early age, and therefore are at high risk that when they run away or when they leave their placement or that home that is caring for them, that they are incredibly vulnerable to be exploited. In fact, a recent study, the 10-city study, looked at homeless youth in 10 U.S. and Canadian cities and specifically asked them questions regarding trafficking, regarding sexual activity, and found that 22% of those youth were approached for sexual services for money, so a commercial sexual act, within the first 24 hours of being on the streets. Our numbers here in Utah are, as we've interviewed our homeless youth population, the majority say that between 24 and 48 hours of being on the streets, they were approached for a commercial sexual act. So what does a community require in order to have a prevalence of minor trafficking victims, specifically sex trafficked victims? When it comes to those ingredients that make, unfortunately, a society vulnerable to trafficking, it includes a homeless or runaway population. The presence of adult prostitution in any location means that there are children also being exploited, whether that is legal or illegal adult prostitution. It doesn't matter. There are buyers who are looking for children, and so that comes along with that industry. If there are a large population of unattached or transient males in a specific locations, whether they work from home for weeks or months on end before returning home, or because there are truck stops, military bases, casinos, sporting events or arenas, convention centers, international airports, resorts. Those are locations where buyers tend to congregate or tend to be in higher concentration. And research would show that there are more purchases of sexual services in those locations. Again, gangs and organized crime, as I've stated earlier, and then anytime you're near an international border, tribal land, or specific smuggling routes, there is a higher concentration of exploitation and sex trafficking. So what is the recruitment recipe that is needed to exploit or to recruit a minor for exploitation? You begin with the media. It's pervasive and diffuse through our culture, and most youth are very aware of the culture that flows around what's glamorized, the glamorization of sex and the pimp hoe culture, the objectification of women. These build a foundation for victimization, unfortunately. Then you have a demand from the buyers. You bring in those persons who work to exploit other individuals for financial gain or some other commercial gain. And then you add into that mix this innate human desire, especially in the teenage and youth population, for love and affection and belonging. If they have a history of trauma, this makes it even more prevalent, this need for affection and recognition. And then if there is a need for survival, such as shelter, food, or clothing, that's just one more ingredient that just sets up these youth for exploitation. We often think of a trafficker as a specific individual, and I want to help us debunk that stereotype that the trafficker looks or is a specific person, because that's not true. Traffickers can be of really any gender, sexual orientation, ethnicity, race, and they can be as young as their teens all the way up through the adult and what we consider the older adult population. So please do not have a specific face in mind, because traffickers can be from any walk of life and any nationality, ethnicity, or religious background. Recognize here that according to the Polaris Project, that the majority of traffickers are romantically involved with the person as they are grooming them, or as they are enticing them into being victims of trafficking. Often that is a romantic involvement. There is the offer of a job or a benefactor, and then, as the first vignette would show, they could just be a family member, friend, or close acquaintance of the family. It's often thought and stereotyped that sex trafficking occurs on the street, that these are stereotyped as women who are out on the street walking the track, and that those persons, those buyers, find them on the street, and that there's an exchange there. Please understand that we are in the 21st century, and no longer do persons only go to the street for the purchase of sexual service. The internet, the social media, the dark web, there's so many other places in which to sell and buy contraband, to say, that no longer is it necessary to be on the street. So the internet is the new location to purchase these. As we've all heard of places like Backpage, fortunately that was shut down. But even though it was shut down, these sales of persons have just gone elsewhere and have found other websites, other classifieds in which to post these ads. Because you can sell a person online and have them located at a residential brothel or other venues, or hotel or motel, and they don't necessarily have to be street based. So, as I mentioned, from the interview that we saw of Sasha Ray, just that little snippet, there is this trauma bonding that occurs, and it's real, and often referred to as Stockholm Syndrome. But it's that attachment between hostage and captor, and it's the rule rather than the exception. There's a power and control wheel that is often used for intimate partner violence, adapted here to show sex trafficking and labor trafficking, that there's significant coercion, intimidation, abuse that occurs, mixed with an appropriate level of affection and love to keep that person, that victim, controlled psychologically. Those psychological tactics that were referred to in the interview. because this is far more effective than the chains or the torture or the drugs and alcohol that many people think of when they think of human trafficking. So if you were to Google human trafficking or just search for it on the internet through any browser, often it comes up as women in chains or behind bars. Unfortunately, that's a stereotype, and that's not necessarily true. The psychological tactics of trauma bonding are far more effective than any of these other methods, especially since these traffickers are trying to sell a product. In their minds, they want that product to be as financially lucrative as possible. So they don't want to injure or decrease the value of that product. So they're going to use these psychological tactics to keep these victims under control. So initially, there are methods such as starvation, torture, rape and gang rape that are used, forced drug abuse, manipulation. They'll use humiliation, blackmail, control of documents, even control of children that are conceived during the trafficking, to manipulate and control these persons. And again, they're exploiting, and that's their goal, and their end goal is to gain financially from these persons. So please do not stereotype that all these persons are in chains. Oftentimes they are free to go, but they will most often return because of these tactics employed. According to Dr. Judith Herman back in 1992, trauma bonding is captivity which brings the victim into prolonged contact with the perpetrator, creates a special type of relationship, one of coercive control. The goal of the perpetrator is to instill in his victim not only fear of death, but also gratitude for being allowed to live. So if we understand the trauma that builds the foundation for the control of victims, we better understand how to approach them when it comes to medical services, mental health services, in general, community-based services. They will need not only to be able to thrive as survivors, but to overcome or to at least recognize and to begin to process the trauma that they have endured for months, even years, during their early childhood into adolescence and through their time of being victims of trafficking. Please understand that the average number of years in the life as a victim of trafficking is 7 years. Number of partners, I quoted, it's somewhere between, can be 10, I've heard upward numbers of 40 to 60 per day, and there are no days off. The leading cause of death is murder, and the second leading cause of death are complications related to HIV and AIDS. A recent study from 2014 conducted by Laura Lederer and others. Laura Lederer is founder and leader of Global Centurion, a non-for-profit that combats human trafficking on a global scale. They found in their study in 2014 that of the victims they interviewed for sex trafficking, nearly 88% had sought medical attention during their years of being trafficked. And you can see the breakdown here. The majority presented to a hospital or emergency room, others to Planned Parenthood or to an urgent care or women's health clinic. 65% went alone to get birth control during their years of being trafficked. So how can we better recognize these victims when they come across our doorstep, or we encounter them in the community or in the services that we may provide? What are some of those signs that should trigger in our minds either questions to ask or persons to notify that we have a concern for potential exploitation or trafficking? So with regards to youth, if they present with no identification, they don't have a way to prove who they are, mixed with other risk factors or other red flags, as we would label them. Again, no single red flag is diagnostic or definitive for human trafficking, but it's the summation of those red flags that can be highly concerning for potential trafficking. So a youth who says that they live with friends or they live with an employer, they can't remember where they live, they're dressed inappropriately for the weather, the time of the year, they have inconsistent stories, they're accompanied by a person who they don't label as by name or a specific person. They just say that might be an uncle or a friend or a family member or relative. But as you press them or press that individual for identifying information or ID, they are unwilling to do so. There might be hypervigilance, fear, paranoia. They're unwilling to speak for themselves, and in fact the person accompanying them speaks for them. They may show general poor health or malnourishment, and they may have quite a bit of cash on them, which is inconsistent or uncommon for their age. They may say that they're older than they actually appear. When you press them for identification, they don't have it, or that identification is false. They've had multiple arrests for prostitution. They've been truant, or they have a history of truancy, runaway, throwaway, or homeless youth, and they have a history of sexually transmitted infections, multiple sexual partners, high-risk sexual behaviors, or even sexual trauma or physical trauma. Any or all of these should be quite concerning, especially as you have more than one during a presentation. That should raise awareness that there's potential trafficking going on here. When it comes to medical needs, as these victims present to medical providers, they will often present because of a physical injury or an infection or a medical problem that has reached a point that they are unable to be trafficked effectively by their trafficker, and so they get to a threshold which they cross, and they finally consent to let this person seek medical attention. This can be physical trauma from the beatings, from the assaults, from the trafficker or by the buyers. These could be chronic problems. When it comes to reproductive health, again, with regards to sex trafficking, there are daily sexual assaults, so they could have sexually transmitted infection, history of spontaneous or induced abortions. Those could be done on the street. They could have genital trauma from those. Unfortunately, those can also lead to infertility. And they could come in with extensive genital trauma, or simply seeking birth control, like 65% did, who presented to medical attention in the Lederer study. Mental health is a huge component of their presentation because, again, it's trauma and their symptoms are going to be trauma-based. So please keep in mind that their symptoms may all be related to the traumas that they've endured from a young age. So they may have post-traumatic stress disorder, suicidality. They may be demonstrating anxiety, panic, depression, all related to their trauma. There are often alcohol and drug addictions, eating disorders, borderline personality, that all are connected to their history of trauma and drug abuse. And please keep in mind that the trauma bond between the victim and their trafficker is quite substantial and can often lead victims who have left to return months later to their trafficker because of that bond and that perceived affection that they've received in the past. When it comes to our encounter with a potential victim, please, by all means, take the opportunity to speak to that victim alone. Please ask who is ever accompanying them to step out. Find a private location, some private time to ask them questions about their safety, about suicidality, about the potential for exploitation and trafficking, and see if they are willing to talk. If they are not, at least give them options for them to call in a secure and private form, which they can carry with them, that will be inconspicuous. Also, if they are non-English speaking or they do not speak the language that you speak, please use a trusted interpreter, and we ask that that not be a family member or a person from the same community, but that you use someone from outside the community, specifically, if available, a phone interpreting service. That way you've removed them from the stigma, the cultural stigma that may be there, and also from a potential trafficker who may be a family member or someone from their community. If working with a child, we would ask that you limit the history to the pertinent information, and once that information is gathered, that be reported as mandated reporting laws dictate to Child Protective Services and law enforcement immediately. People often ask about highly sensitive human trafficking questions. In the medical setting, we ask that you use these for screening purposes on those who have some of those risk factors. Again, this is not indicated in screening of every adolescent or adult who comes through a medical setting, but those that are indicated, we ask that you use a questionnaire such as this, one that has been recently published by Greenbaum et al. In 2015, and there are others out there, but they ask specific questions that are sensitive, such as survival sex question. Has anyone ever asked you to have sex in exchange for something you wanted or needed? A potential trafficking, early grooming trafficking question. Number 2, has anyone ever asked you to have sex with another person? There's the exploitation, potential child pornography question. Has anyone ever taken a nude or sexual picture or video of you and then posted that or shared that via messaging or online? Have you ever been forced or asked to dance at a strip club or a bar? And then getting to the information of vulnerabilities. So do they identify as LGBTQ? Do they have a mental health diagnosis? Have they ever run away or been kicked out? Have they ever been homeless? These are good questions with regards to sex trafficking vulnerability. And then you can ask specific questions regarding labor trafficking, such as where do you live, where do you work, have you ever lived with your employer, have you ever not been paid what you were promised with regards to work. And then asking further, identifying information if the responses are yes. So if we identify a victim, what do we do next? So here locally in Utah, we would ask that you, if a minor is involved, that you call DCFS, which is the Division for Child and Family Services, and law enforcement. The division I work for at Primary Children's is Safe and Healthy Families. Our contact number is listed here at 662-3600, or your local Children's Justice Center, which are coordinated with Safe and Healthy Families and the Attorney General's office to provide forensic interviews and medical examinations to all children and youth who have been sexually assaulted, abused, or victims of trafficking. The National Human Trafficking Hotline is listed here. They have resources nationally, especially for persons who don't know their local resources for trafficking victims, and as a way to follow numbers. They are available, and I would encourage you to call them after you've called the above numbers. And then the Utah Trafficking in Person Task Force has a hotline that you can call. It doesn't fulfill the mandated requirement to report for youth victims, but it is a way in which we can investigate potential trafficking cases here in Utah. Again, you don't have to know for sure whether it's trafficking. You can call the hotline and that task force can take over further investigating that concern. I would like to say that the role of the Children's Justice Center here in Utah is that we provide forensic interviews, medical examinations, and treatment, and work with the multidisciplinary team of law enforcement and children's services, as well as the courts, to ensure that each child victim receives the appropriate services that they need, both in the community as well as mental health services when they leave. So I would encourage you, if a child is involved, to reach out to your Children's Justice Center after making an official report to DCFS and law enforcement. They also are able to provide training and education and those referrals to mental health services. So with regards to mental health services and to medical services, anytime we interact with a victim of trafficking, I would encourage you to approach them with an understanding of the trauma that they've been through. And this is labeled as trauma-informed care. And it's basically understanding that they are victims of trauma first and foremost. And so approaching those victims from an understanding of what has happened to you will improve that interaction and will improve the victim-centered approach that we all strive to achieve when it comes to trauma victims, especially youth. So I'd like to share just a little information on the mental health services, specifically the trauma-focused therapies and services that are available here in Utah. Again, these are not evidence-based yet for trafficking victims, but there's research ongoing to see how well these can apply to the trauma sustained by trafficking victims. In order to understand the reason behind these services, we first need to understand that in order for us to overcome toxic stress, we have to have the ability for resiliency. And this develops early in childhood, that as we are confronted with stresses, we use our protective factors to build that resiliency back from that stress. Those protective factors can be family, community, religion, school, friends, safe home, siblings, pets. Those are things that help us build that resiliency. Unfortunately, when those protective factors are not available, that stress can become toxic and turn into trauma, which then develops into potentially post-traumatic stress and other mental health symptoms. So the first evidence-based therapy for trauma, though not specifically for trafficking victims yet, but can be used potentially for these victims, is CFTSI. Now, CFTSI is Child and Family Traumatic Stress Intervention. It's a 4 to 6 session brief intervention, and it's modeled for kids, and it's used to help prevent the onset of post-traumatic stress disorder. It involves both the youth and their family. It addresses the current stressors, the risk factors, gets targeted case management involved, and then really focuses the treatment on symptom identification, enhancement of coping strategies, and improves that communication within the family with regards to the victim. CFTSI has clinical goals that really want to improve that awareness of the symptoms, improve the communication within the family and within the caregiver child dynamic, and helps understand as well as communicate the trauma and the symptoms, so that it empowers the child for resiliency and for awareness. And it's really building that resiliency to prevent post-traumatic stress. It's shown that children who receive CFTSI 65% less likely to meet full criteria for PTSD. One step above CFTSI is TFCBT. So if you are outside of that window for CFTSI intervention, if the child already has post-traumatic stress symptoms or has been a victim of sustained chronic trauma, such as years of trafficking, trauma-focused cognitive behavioral therapy is the route in which that victim should should go when it comes to therapy. It is 12 to 16 weeks and may need to be longer for trauma victims of trafficking, but it's shown to be effective in children 3 to 17 years of age, acute or chronic, and again, who have any of the symptoms associated with trauma. It's a combination of psychoeducation, relaxation, didactics, and narrative that empower, again, that child to better cope with the trauma that they've sustained. It involves the parents, the caregivers, as well as the patient, and it works similar to CFTSI, but much more intense as it builds that resiliency from the trauma that they've sustained. It is a longer therapy program and may need to be extended even longer for sex trafficking and labor trafficking victims, but has shown effectivity in youth with regards to other types of trauma. So I leave you with the understanding that there are trauma therapies available. They are currently being researched with trauma victims, but they have been shown to work with other forms of trauma in childhood. And I would encourage you that the sooner the child, the victim, or survivor can begin their trauma-focused intervention, the better it will be for that trauma victim as they work through their resiliency and their recovery. So I leave you with this final slide that trafficking in any of its forms is pervasive across the world, specifically here in the United States and in Utah. It is also prevalent. And as we move forward in recognition and in screening, hopefully we will be better equipped to ask the right questions and to call the right experts when we are concerned. And I leave you with this quote by William Wilberforce that you may choose to look the other way, but you can never say again that you did not know. So I will encourage you to act and to bring to light the often overlooked pediatric crisis of trafficking. I've included here the contact information that I've alluded to and suggested throughout this presentation. Here's my contact information via email as well. If you have specific questions regarding patient care or trafficking in general, I am available through that email. Also, here are a number of anti-human trafficking programs and resources across the country, and there are many I have not listed. Many of these are survivor-led and are fantastic, strong programs that really can be mentors to youth who have been victims. Some of those are gems out of New York City. Here are a number of resources written by victims and survivors who share their personal stories, and these are powerful nonfiction portrayals of their experiences, and they can be quite informative for resources and for an understanding of what services are needed by survivors. I'll leave with you my references. And with that, I thank you for listening, and hopefully you will go forward with an understanding of what trafficking is, how prevalent it is in our country, and what you can do to bring this to light and to help victims become survivors. Thank you for listening.